Okay, right.
Good morning and welcome back. We're continuing with our physician interviews. So, could you please welcome Dr. Jayaswal? Dr. Jayaswal, could you tell us a little bit about yourself, why you decided to practice, and how you in Medina, and how you actually ended up in Medina?
Um, I graduated from medical school in 1962 in Patna, India. And then I went to England in 66. I traveled quite a bit around different parts of the world and stayed in England for about 9 years, 3 years in Canada. And then I didn't like any one of those places. I got fed up. So I started looking around. Came to the United States in 1978. I was working with a group in Cleveland and was also senior clinical instructor at the Case University Hospital for a year. And then I started looking for a place to practice. I was very academic minded right from the start. I worked in very large hospitals, in teaching hospital in India, and very large regional hospitals in England. So academic minded. I started looking around and I found that University of Illinois was opening a new medical school in Peoria. So I went there, interviewed, and they accepted me, offered me a position as associate professor of medicine. Then I came here and I met some friends. And my wife and my friends, they started convincing me to try private practice instead of going for academia. So one of my friends brought me to Medina and introduced me to Ed Hall. Ed Hall was the administrator of this hospital at that time. And I tell you, nobody says no to Ed Hall. He was, amazingly, he convinced me that the best thing for me is to open my practice here in Medina and go from there. And I also looked at this hospital. It was a Medina community hospital at that time. And when I looked at it, because of my background, I kept on thinking, I can do a lot of things in this place. And Ed was very cooperative. And so I joined Medina Hospital in 1979 and have been there since I retired in 2010. And when I came to Medina, how I came to Medina is totally karma. It's very difficult to explain to you fully how this happened, but it has happened. And I've not regretted it one bit since I've come to Medina. The good thing was that Ed Hall was very cooperative and allowed me to do a lot of stuff that they were not doing here. And so I talked to him about cardiology, which was, I have a broad training and experience in internal medicine with a special attention, special focus on cardiology. So I talked to him about cardiology and he was very enthusiastic about it. So he allowed me I implanted the first permanent pacemaker in Medina Hospital's history in 1980 or 81, I think 81. And I had implanted quite a few in Canada, so I did that over here. When the electrophysiologist, the specialist in electrical medicine of the heart, started coming here, I stopped doing it and gave my patients to them. I introduced echocardiogram to this hospital. We didn't have echocardiogram at that time. I also introduced a remote heart monitoring called Holter monitor of the heart to this hospital. Those are the two things that I started. Plus, they were transferring a lot of patients from here to Akron or to Cleveland. Uncomplicated heart attacks, we could treat them here, no problem. Some patients with serious pneumonia, there was no need to transfer them. We could intubate them here, treat them here, antibiotics, and follow them closely. If they needed any intervention, then we would transfer them to the bigger institution. Otherwise, we started treating them all here. And that's how my practice started. The most beautiful part of my practice was done by nurses in this hospital and other doctors. They started referring patients to me, and the nurses spread the word for me, I think. and I got their patients, their family members, their friends, they all started coming to my practice. And fortunately, it was very, I'm very proud to say that in 3 months, my practice had almost become full, which was not known at that time, especially in a small place like this. And one of the other things that I'm very proud of is that we had a retreat from Medina Hospital a few years later, and we were having lunch, and there was a speaker from IBM. I forget his last name, but his first name was George. We were having lunch at the table together with Ed Hall, George, and I think Dr. Astriaco was there too. And I suggested to them at that time that we should change the name of this hospital to Medina General instead of Medina Community, because that denotes a much bigger institution, and we wanted to make this a regional medical center. So, and they both agreed at that time, and then George and Ed Hall decided to change the name of this hospital to Medina General Hospital. And so that's how this hospital became the General Hospital. Ed Hall brought a lot of different specialties. He invited quite a few of them, and that's how the hospital grew, and really had become a regional medical center in many ways until the Cleveland Clinic and it decided to buy us. This was a great hospital to work in. The nurses were, wonderful. It was like a small family in many ways. People in the administration were very friendly, and the other colleagues, there was a sense of very, very close friendship, collegiality amongst the doctors.
So you've talked a lot about the changes that you've made at Medina. Can you talk a little bit about the changes, any of the major changes in your specialty of cardiology?
Oh, now because the Cleveland Clinic has taken over, actually even before the Cleveland Clinic, they had opened a cardiac cath lab in this hospital. I'm not an invasive cardiologist, but there were some doctors here who did invasive procedures. So they did the heart catheterization at Medina Hospital. And then when the electrophysiologists started coming, they started doing all kinds of very invasive permanent pacemaker implants in both sides of the heart. Initially, we used to put it only on the right side of the heart. Then they started doing more invasive procedures. If they needed more than that, they used to take them to the bigger institution in Cleveland. But they started doing a lot of things over here. Other specialties grew. The orthopedic department became wonderful. There are a number of doctors that came in. The rheumatologists started coming in. And of course, ophthalmology, he brought some, Dr. Mast brought some partners with him, and they expanded the hospital. They started doing a lot of cataract surgery here. So there were many, many advances that occurred. Plus, the hospital built this new wing, and the new wing was a wonderful addition to the old hospital. And they got a number of new nurses, who were trained with higher training. There was a tremendous amount of advancement since I joined the hospital.
So I know that you have many memories of your practice. Would you like to share maybe what your most poignant memory is of your practice in Medina?
Initially when I came here, as I told you, I was very academic minded. I was not sure I would really get satisfaction personally. Fortunately, because of the background of internal medicine, I also saw a lot of internal medicine patients. We had I was amazed at the number of rare conditions that were still around in this area. And what impressed me most initially was the number of underactive thyroid that was in a number of places, especially in the Lodi area. Patients from Lodi area, I was amazed at how many underactive thyroid was there. Then we had some very rare patients. One of them was a lady who had seen a number of doctors with no diagnosis. She finally came. I examined her, and she had a changing heart murmur with posture. So that made me start thinking there's either a tumor there or there's a ball valve thrombus. So I got an urgent echocardiogram done. She turned out to have a left atrial myxoma, which is a tumor. Most cardiologists will die and not see one. And I saw one in Medina. You know. So there were a number of other conditions. There was a neurological patient who was having a lot of problems with muscles and things, and people didn't understand what was going wrong with her. So I examined her and told her, okay, I think I know what you've got. I took her to my restroom, put the water very cold, told her to grab hold of the faucet and let go, let go, let go, and she could not let go at all. So finally, I turned it and made it warm. She had a condition called dystrophia myotonica. It's a very rare genetic condition. So I told her to get her brother, her family members checked out. Her brother also had the same thing. This condition causes a heart block. So when I examined her and I did the EKG, there was a first degree heart block. And I told her that initially it is only mild, it'll continue to progress, and it will need a permanent pacemaker implanted. And eventually she did. The heart block became more and more, and she had a permanent pacemaker implanted on her. So that was the two very rare conditions that I saw in Medina.
That is amazing. Thank you for sharing. So, what do you think is we're going to change it just a little bit. So, what do you think is the best change that you've seen in medicine in general today?
In every single week, there's a new advancement. In cardiology, especially, plus the drugs that we are using now. When I became a doctor, I was asked to give a lecture to the dentist one time. And the first question they asked me, what do you do today that you learned in the medical school? I told them, nothing except the basic pathology that we were taught. That has built up the background of medicine. There's so many new drugs that came out, so many new procedures that came out, and so many things that we could do that we hadn't in 1962 was not even thought of. And now you can see, especially in cardiology, there's so much advance in cardiology. They can almost go in a pregnant woman and a child with a heart hole. They can go in a pregnant woman and close that hole in the heart, while she is still in the womb. So there is huge amount of practice improvement that has happened. Thank God for that. That's why people are living longer now. And before when I became a doctor, there was only 2 drugs for high blood pressure, and there was hardly any drug for diabetes. Now we have hundreds of them. So there was a tremendous advancement that has occurred over the years. Plus, I'm sure that there are surgical procedures, orthopedic procedures that they are doing now that were not even heard of before.
So, with all of the changes that have happened, is there anything about them that saddens you?
Exciting?
Saddens. Makes you upset, or that you miss, or
the only thing we old doctors miss is that we don't see the same kind of camaraderie amongst physicians. Number 2, the corporations have taken over. They have turned it into a business. When I went to medical school, I did not have a single class, not even one class on how to run an office. There was no business news. Nobody knew that. We just went into practice and developed it. Now I'm sure that they are taught. The thing that bothers me the most is that when you go to a doctor now, they've got a 15-minute slot. We in practice saw the patient until they were satisfied. It was very different. They were like a member of my family. I could not let them go without satisfying them, and telling them exactly what they wanted to hear or what they wanted to know. That is something that personally, as a patient also, I've felt it when I go to see a doctor. They look at the time slots and you're out.
So, given your extensive experience, what would be your best advice that you could give to new physicians in their practice, or new people coming and thinking about becoming a physician?
Be very compassionate with the patient. That would be my first advice to any not even doctors, but everybody, but the doctors especially. People are sick, they need help, and you have to be really compassionate with them. Take care of them, talk to them. Unless what happens nowadays, they've got this laptop and they're typing this and they're asking questions, and we never did that. Face to face, listen to the patient. As a matter of fact, 80% of my diagnosis was made by listening to the patient. 20% and 10% was with examination and 10% by tests. 80% of the diagnosis I made was just listening to the patient.
So what do you think you see? What do you think you see in the future for both the cardiology profession or specialty and medicine in general?
I'm afraid it will be machines. The machines will be taking over. You will come in, even now, before they see you, they do an EKG on you, in cardiology. Number of patients, if they have a murmur, they tell you, go and get an echocardiogram done before the doctor sees you. The advancement in machines, the AI, artificial intelligence, that's going to happen, will be making there are two parts to it. One is the good part. The diagnosis will be so easy to make with the AI and all those things. They have diagnosed conditions that was difficult to diagnose or not diagnosed. The bad part is that the rapport between patient and doctor is going to be missing, unfortunately.
So, in summary, do you have other thoughts that you would just like to share in terms of the practice of medicine, either in general or in Medina?
Well, Medina has improved tremendously since I first came here in 1979. It was a community hospital. Then it became the general hospital. And now it's a part of the Cleveland Clinic, the huge, big conglomerate. There has been advancement because they have brought a lot of specialties and machines and surgeries and all kinds of things. Most of the advancement that I think will happen will be related to the AI, as I'm seeing it right now. They are going to make drugs, do investigations, testing, make it so much easier. Over the years, it will become, that is the thing that's going to happen next to medicine, is the AI, artificial intelligence, as I see it. I may be wrong, but that's my reading right now. That this is going to happen, and the doctors will just be carrying machines in their pocket, and they will listen to you, and that machine will really give you the exact diagnosis, and maybe even treatment plans. The drugs, they are going to explode. Right now, there are already new drugs that are coming out that are just totally amazing. The future of the drug industry that I see with AI, I think is going to explode. It's going to become so much easier. Unfortunately, it'll cost a little bit more. But cost aside, I think it's just going to be a tremendous advancement in taking care of patients and people.
Thank you so much.
Great. Good job.
We very much appreciate your expertise and
Thank you.